Hello friends, today we are going to talk about blind nasal intubation. Blind nasal intubation is like forgotten art. In last few decades, we do have many gadgets like fiber optic bronchoscope or fiber optic laryngoscope to intubate the patient with difficult airway or in patient with restricted or zero mouth opening. But before 10 years or so, we were using this technique regularly because fiber optic bronchoscope was not available to us. But recently, in last 2 years, we have started utilizing this technique again. This is because of Corona pandemic. When we use fiber optic intubation in Corona patients, or in the time of Corona, in those patients who are Corona negative, there are chances that test is false negative and patient is carrier and we can have infection. But when we do fiber optic intubation in such cases, there is larger exposure time. You may require few minutes for a fiber optic intubation. But when you do blind nasal intubation with tactile technique, you require very less time. Usually, blind nasal intubation is done awake, but we do it after giving general anesthesia. In this patient, we give propofol, then we check the ventilation, then we give scoline, and then we intubate. How we do it, I will show you in the video. Position is very important. You have to give extension to the patient, extension of the neck to the patient. Here you can see I put a plastic saline bottle below the shoulder of the patient so that I get adequate extension. I'll pre-oxygenate patient for at least for 3 minutes or up to 5 minutes. This will give me adequate time for intubation, and if in case I fail to intubate the patient will recover out from the scoline and patient will have a spontaneous respiration. Here you can see I have pre-oxygenated the patient. My assistant has given propofol and scoline. I'm ventilating the patient. Then I will insert the tube. This tube is very important. This is Cortex tube. This is very soft. It has least chances of injury. So there are less chances of bleeding. So this tube is important. This tube has got beautiful curvature, and it usually goes inside the larynx if you use the proper technique. Elevation of the jaw is very important. You have to give jaw thrust to elevate the mandible, and it will make the axis proper for intubation. So here you can see I will give jaw thrust. I am giving jaw thrust here, and now you can observe here. You can see the tube movement here. I will show you again. You can see the tube movement here. I am sure tube is inside, but I will confirm with EtCO2. I will attach the circuit. I am inflating the cuff, and now I will see in the monitor for EtCO2. So I will watch for the EtCO2 graph. I will look for the 6 wave confirmation. Here you can see. Now I will checking the EtCO2 graph, and you can see the EtCO2 graph there. I'll check till 6 waves. That will confirm that tube is inside trachea and not inside the esophagus. Here you can see 3, 4, 5 and 6 wave. So here you can see tube is inside, and I am sure this technique will help you to do blind nasal intubation. Blind nasal intubation is very easy technique. If you start practicing it, initially you should start practicing in patient with adequate mouth opening, and once you become expert you can start using it in other patient also. So this is all about blind nasal intubation. Thank you very much.